provided about Neisseria gonorrhoeae, a gram-negative diplococcus with unique pathogenic, diagnostic, and treatment characteristics. Question 1. Neonatal conjunctivitis. A 3-day-old newborn presents with purulent eye discharge and eyelid swelling. The mother had no prenatal care and reports vaginal discharge during pregnancy. Gram stain of conjunctival exudate reveals intracellular gram-negative diplococci. Which of the following is the most likely organism? A. Chlamydia trachomatis. B. Neisseria gonorrhoeae. C. Haemophilus influenza. D. Staphylococcus aureus. E. Pseudomonas aeruginosa. Neisseria gonorrhoeae. Explanation: N-gonorrhoeae causes early onset neonatal conjunctivitis 2 to 5 days post-delivery. Grams of diplococci found inside neutrophils on gram stain. C. trachomatis, later onset 5 to 14 days, no bacteria seen on gram stain. H. influenza and S. aureus are less common in neonates. P. aeruginosa causes more severe keratitis, not common in neonates. Question 2. Fitzhugh-Curtis syndrome. A 22-year-old woman presents with RUQ abdominal pain, fever, and vaginal discharge. She is sexually active with inconsistent condom use. Pelvic exam shows cervical motion tenderness. Ultrasound is normal. NO8 is positive for Neisseria gonorrhoeae. What is the most likely complication involving the liver? A. Hepatic abscess. B. Hepatitis B infection. C. Fitzhugh-Curtis syndrome. D. Portal vein thrombosis. E. Gallbladder carcinoma. Answer: C. Fitzhugh-Curtis syndrome. Explanation: Fitzhugh-Curtis syndrome is perihepatitis from PI, often due to N-gonorrhoeae or C. trachomatis, characterized by violin string adhesions on laparoscopy. Hepatic abscess or viral hepatitis would have liver function abnormalities and imaging findings. Question 3. Virulence factor. Which virulence factor of Neisseria gonorrhoeae is responsible for immune evasion and is a key reason no effective vaccine exists? A. IgA protease. B. Lipooligosaccharide, LOS, C. type 3 secretion system, D. Pi with antigenic variation, E. Exotoxin A. Pili with antigenic variation. Explanation: N-gonorrhoeae frequently changes pilus proteins, preventing effective adaptive immunity and vaccine development. IgA protease cleaves mucosal IgA but does not prevent vaccine efficacy. LOS contributes to inflammation but not immune evasion alone. Type 3 secretion system and exotoxin A are seen in Pseudomonas and others, not Neisseria. Question 4. Diagnosis. What is the most accurate diagnostic test for Neisseria gonorrhoeae? A. Gram stain. B. Culture on chocolate agar. C. Nucleic acid amplification test. And D. Rapid antigen detection. E. ELISA for bacterial antibodies. Answer: C. Nucleic acid amplification test. Explanation: NAPI is the most sensitive and specific test, often done on urine or genital swabs. Gram stain can help in males but less sensitive in females. Culture requires selective media, thermartin, but is less sensitive. Antigen antibody testing is not used for diagnosis. Question 5. Treatment. A 27-year-old man presents with urethral discharge and dysuria. NAT is positive for Neisseria gonorrhoeae and chlamydia testing is pending. He has no drug allergies. What is the appropriate initial treatment? A. Oral ciprofloxacin only. B. IM ceftriaxone only. C. IM ceftriaxone plus oral doxycycline. D. Oral azithromycin only. E. Oral metronidazole. Answer: C. IM ceftriaxone plus oral doxycycline. Explanation: CDC guidelines recommend ceftriaxone 500 to 1,000 milligrams IM plus doxycycline if chlamydia not ruled out. Ciprofloxacin is not used due to resistance. Azithromycin monotherapy is no longer recommended. Metronidazole is for trichomonas or BV, not N-gonorrhoeae. Let me